When it comes to breast implants, there are several options: saline, silicone, and textured implants. Recently, there's been a recall to certain implants because of the potential cause of acute large cell lymphoma. Another potential issue is breast implant illnesses. So what does all of this mean, and what should you do if you have implants? Our friend Dr. Kordestani joins us today from AOMS with more. This is a hot topic. It is in the news all the time. There are new developments sort of coming out continually. So I think that we should really kind of give a lot of time to this. I want to start with talking about what the differences are between each of the implants.
Okay, Megan, as always, thank you for this, and thank you for this because of the fact that I think it's important. As you mentioned, we just had a concern about a recall, and all of us got inundated with phone calls, everyone very panicked and scared, and the first thing is we want to say, take a breath, we're here, but let's go through it one step at a time. So I brought in some implants as you had asked. So actually this is a saline implant. As you can kind of see there's water in it, and that's one of the types of implants. You had asked about textured implants, and this is a textured implant. If you can actually take a look, the shape and the actual overlying area is different. You can see it's spackled. So, and then this is what we actually have a slang name for it as gummy bear. This is a silicone cohesive implant. This is the most up-to-date. So if in fact this gets cut or damaged, it just sits there, the inside of a gummy bear.
Okay, got it.
So
I see.
These are some of the most common types we're having.
Of the three, which is the most commonly used? Maybe in our area. Okay, that one is.
Not just in our area, in the whole country.
The whole country.
Yes.
And now the textured implants, correct me if I'm wrong, are not used as, they're not the preferred implant, obviously, right?
Well, that actually depends. Textured for the longest time was designed because one of the problems we have with any implants is capsular contraction, where you get a shell that's thickened around an implant. So when this was designed, it came to us and came to the American Society of Plastic Surgery as this might be an answer against capsular contraction. So let's put this in with the hopes that we don't get capsular contraction. 10, 15 years into it, there's no difference at all.
Okay.
You kind of learn as you go.
Now the recall and the issue with acute large cell lymphoma is more connected to these textured implants, am I correct?
Correct, and you have to be careful how you put it. So textured implants, if you have a texture, it doesn't mean you're necessarily going to get cancer. It doesn't mean you have a risk for cancer. What it says is when all the data in the whole planet is looked at, and we retrospectively turn around and look at it backwards, retrospectively, okay, what's the most common? And the most common implant that in those patients who do have cancer is textured implants.
Okay. And we're talking about a very small percentage of the population of people, even with the textured implants that are getting it.
And the most recent data shows that if, in fact, you walk through the door, the chance of you having or getting ALCL from breast implants, the most common is 1 to 2,000. The least common is 1 to 86,000 implants put in. So that's not very common at all.
Okay.
But again, it's a situation where that I would say to you when you came in and you were panicked, first I would give you a hug. Second, I would try to calm you down. And then I would kind of talk you through this.
Okay, now when you're getting these implants, if you're still out there, you're thinking about getting implants, how do you know which one is right for you? How do you make the choice?
It's really a situation. First, I would educate myself by looking at some basic questions on the internet. As you know yourself, the internet can be useful, and sometimes the internet information can really put you in a whole different direction. So what I would do is just put some questions down, get all those questions written on a piece of paper, and come and see your plastic surgeon, and then go through it. And our job is really, first and foremost, to educate. And then our job is to be your partners, choosing the right implant, and then going through the ordeal with you.
Okay, so let's say the ladies out there, they've made the decision, they've gotten the implants, now they're panicked, as you say. Should people immediately have them taken out? Let's just be explicit with that.
Very clearly, FDA rules, American Society of Plastic Surgery recommendations, guidelines, everything across the board is no. Very, very few of the implants will present as problems. This is not a situation where you have a recall that everything in 1999 Ford gets recalled. This is not that. This is saying that a specific type of implant may have a specific type of problem. Not all implants. Very few implants, and even at that, much, much smaller. So the idea is first, That's a piece of information that's been relayed across. Pick up the phone or look at your implant card. Everybody who has an implant is supposed to be given a registration
So you
card.
know exactly what it is.
You should be. You know, we have a situation where a lot of the people in the local community head off to Oklahoma City, and a lot of the surgeons in Oklahoma City aren't plastic surgeons. So they come back to us, and they go, I didn't get a card. I'm like, everyone's supposed to get a card. So based on that card, you will know. Even without the card, if you come to us, we can help you by going through the implant companies and get the information for you.
So you're absolutely certain. Now let's shift gears a little bit and let's talk about breast implant illness. This is another thing that's sort of making a lot of news, and I want to make sure that we define these two things very differently.
Sure.
There's breast implant illness, and then there's the cancer risk and scare and challenge. Breast implant illness is not something that's identified by officials, right?
Well, the better way to think about it, I mean, that's exactly correct.
Okay.
Layperson looking at it saying, it's ill-defined, I don't know what exactly it is, but I don't feel right. That's the biggest umbrella you could do.
And it has a multitude of symptoms.
You know, I've read so much about this, I've seen so much of this, and so many different communiques go across in American Society of Plastic Surgery, these are the ill-defined symptoms. Patients come in and say, lack of ability to focus. I'm foggy all the time. I have random aches and pains. I have chronic fatigue. So if you really think about it, that could be something to do with the implant or it could be the flu. So I really can't put a finger on it, as opposed to something that's centered in the breast tissue, breast cancer, that is definitely, it's a mass, I can put my finger on it, or we can detect it on an MRI or something and say, that's breast cancer. Breast cancer is different from ALCL, which is different from breast implant illnesses. So it's one of those things where you really want to educate yourself. Or again, our role is to educate. If something really has got you going, come in, sit down with us. We can educate people.
I think a lot of people are saying also you can't determine if you have any sort of illness or anything until you take out the implant. Is that true or false?
That's actually questionable.
Okay.
And I'll explain. Because of the fact the idea is you have possibly a random set of symptoms, as we said, very similar to the flu, and you're absolutely certain that it's caused by your breast implants. Well, the data in the American Society of Plastic Surgery doesn't favor that. There's no proof of that. And again, our job's not here to say, no, we don't believe
Right.
you. That's not the case. Patient comes in, they obviously have a concern. So our job is to be accommodating, but our job also as scientists is to say the data doesn't support it. But the only way you can really look at it, as you pointed out, is, okay, I don't know if I can help you, but if you're absolutely convinced it's the breast implants, the only experiment we can run is to take the implants out, take the shell out, let you heal, and see if the symptoms resolve. If it did, then I can probably say it was due to that.
It was because of
and
the
if it didn't, I don't have an answer for you.
I mean, it's a very fascinating thing, and there's so much literature that you can read about online, but I think the most important thing is if you have implants and you're concerned, you go and you visit your doctor.
Because we're here to help.
Absolutely. Dr. Cardestani, thank you for being here today.
It's
We
always a
appreciate you.
pleasure.
Really, really interesting. Stick around. We've got more Studio 4 right after this.